All over Ontario, we hear the same thing. The healthcare system is in trouble. Too many patients without a family doctor. Too many patients with chronic illness such as diabetes, obesity, smoking, emphysema. It's just not a pretty picture. How did it get like this? As well-meaning as it was, the healthcare system just wasn't designed to look after patients to keep them well and healthy. We may even be causing them more harm than good. For example, until a few years ago, we doctors were paid fee for service. That means we got paid for each person we saw. Most of those people were sick or had some illness that brought them to the office. We spent 5 or 7 minutes with them, on their way, see another patient. Waiting room is full. We just didn't have time to do preventative care. We weren't funded properly for it. There were people in the community who could do such things, such as dietitians and physiotherapists, but we didn't have a way to access them. The only way to get to those services if you were a patient was to be admitted to hospital, which means you were really sick and then it was almost too late, kind of like closing the door after the horse is gone. How do we fix this system? It's all about communication. Some of those providers have an office in the community, but how do you get hold of them? And if you do get hold of them, how do you pay for them? Private insurance? Do you have your own money? Who knows? Hey, here's Laurel. Laurel's a registered dietitian with our family health team. Laurel's an expert in food and nutrition, and she's working to counsel our patients. Who would you rather be counseled by? Laurel with her 6 years or me with maybe 6 hours of medical school? I think the answer's obvious. See you later, Laurel. We've got to do something different. We've got to make a change. We've got to figure out how to provide more county residents with health care that's the right kind and that we can afford. Tall order. And I know what you're thinking, change is bad. Not so. Consider this, here in the county we've already been making changes to our healthcare system. So far so good. A few years ago, county docs decided to get together and see if they could provide better care to more people by forming a team, the Prince Edward Family Health Team. Now it may not look very different at first blush because we're all still practicing in our usual offices, but we're working on that. More in a minute. Good news, more patients now have access to a doctor and other health professionals like Laurel without having to be admitted to hospital. Here's the thing, since we formed a team, we've been able to look after over 5,000 more patients than we did before we were the team. I'd like to take credit for that on behalf of my fellow physicians, but the real secret has been the new members of the team, like the nurse practitioners. Hey, here's Sylta, she's a nurse practitioner with our team. A nurse practitioner is a special nurse who's had extra training and allows her to make diagnoses, order lab tests, write prescriptions, and give health care counseling that keeps people healthier and hopefully out of hospital. Thanks, Sylta. You see, when the Ministry of Health formed family health teams, they could fund these teams to hire additional healthcare staff. We've got nurse practitioners, social workers, pharmacists, mental health workers, perhaps in the future physiotherapies. Having them as part of the team means more people can get the right care from the right healthcare provider, and we can focus on people being healthier in the first place. Cutting edge stuff. Good, but why stop there? Hey, there's Debbie from Community Care for Seniors, a local organization that specializes in trying to keep seniors in their home as long as possible using special services to help them achieve that. How easy is it for us to get referrals back and forth? It's not, but we're working on it. Thanks, Debbie. Let's make that circle of care even bigger. What about those other issues that affect health care? Things like transportation for seniors, someone for a teenager to talk to when they're upset. What about Meals on Wheels to get hot meals into patients' homes? What about a pregnant teenager who doesn't really know how to care for a pregnancy? There's a lot of great people working with other organizations within the county. Organizations like Public Health, Mental Health Services, Community Care for Seniors, Hospice Prince Edward. Why can't you and I bring them into your life from our clinic or the hospital or from your home? Why can't we be all connected electronically or even physically in the same building? We're on the verge of a breakthrough here. High quality, affordable care from the right people at the right time to the right place. One-stop shopping for all your healthcare needs. I'm excited, and I think that's worth working for.